Check your volume. New research finds a growing concern linked to hearing. By 2040, 1 in 4 people in North Carolina will suffer from hearing loss, now linked to a decline in cognitive ability. This morning, we have a very special guest. We're joined by Dr. Shelly Cristobal with Durham's Hearing Healthcare Services. Shelly, Dr. Cristobal, good morning.
Good morning. Good morning. I'm excited to be here.
Absolutely. What can you tell our viewers about the hearing issues that you see firsthand in your work?
Well, certainly, hearing loss is widespread, and it's hard to self-assess, to have a good sense of your own hearing difficulties, because hearing is so sneaky. Often, hearing loss isn't like putting in a pair of earplugs. It is more like it sounding under a blanket or muffled, missing just pieces of sound while you're able to hear other pieces.
Definitely, and as you know, the Journal of the American Medical Association recently published a finding about dementia's linked to hearing loss. What can you share about this research and its impact on people?
This is absolutely something we see at Hearing Healthcare Services. The connection between hearing loss and dementia is a very strong one. And the research we've seen come out over the past few years has shown of all the things we can control that contribute to the development of dementia, hearing loss is the most influential of those things that we can control. So treating hearing loss sooner rather than later is a great way to maintain a healthy brain.
Do you have any preventative advice for people, things that people can do now to prevent this?
Absolutely. So your usual to-do list of staying healthy, of a diet of lots of different fruits and vegetables, of food-based antioxidants, moderate exercise at least 3 times a week, and then wearing earplugs or hearing protection if you're going to be around sound that's so loud that you have to shout to be heard over it for any period of time. If you love to rock out to your music, crank up your favorite song, but when your favorite song is over, turn it back down and keep that sound where you can talk over it is a good rule of thumb.
And Dr. Cristobal, we know, go ahead.
Oh, in addition to that, the newer recommendation would be to get your hearing checked at least at age 50 and every 5 years after.
I'm glad you mentioned that because there is this stigma, right? This idea that hearing loss is really only a concern once you get older. But can you explain, is this something that younger people should be aware of?
Absolutely, and we're seeing a huge cultural shift. Our younger folks, our Gen Z and millennials, seem to be much more interested in managing their health and staying the best version of themselves. And if you're having a little bit of trouble hearing, if you're missing a few things, life gets a lot harder. And so if we treat hearing loss as soon as it becomes an issue, you're able to keep a healthy brain, but also stay the best version of yourself.
That's right. Turn the volume down and take the necessary steps now. Dr. Cristobal, we thank you so much for your time and insight and joining us this morning.
Absolutely. Thanks so much for having me.
Have a great day.